Hi everyone, today we are going to present a seminar with the title Breast Cancer, Immunity and Immunotherapy. Our group is formed by me, Iago Pereira, Júlio Batista, Paula Dibi, and Rosana Costa. To begin, it is important to understand the situation and estimates related to cancer worldwide. It is estimated that at least 18.1 million new cases of cancer occur worldwide each year. The World Health Organization also estimated that by 2040 there will be 29.5 million cases of cancer per year. Another data available for public consultation is that in 2018 there were 9.6 million deaths caused by cancer. Some data show that one scale of the types of cancer the most affect Brazilians is lung cancer in the first place followed by breast cancer. When we speak at the national level here in Brazil, it is estimated that 66 million new cases of breast cancer will occur between the years 2020 to 2022. Okay, but with this information, a question arises. What is breast cancer? Breast cancer is a disease that occurs due to the lost ability of cells to limit and control their own growth, multiplying quickly and without control. The breasts are glands formed by lobes, which divide into small structures called lobules and mammary ducts. And a mama it has 15 to 21 lobules that are made by lobules and lactiferous ducts. The most common type is called ductal carcinoma because it originates in the cells of the breast ducts. Lobular carcinoma, less common, originates in the cells of the breast lobules. In addition to being lobular or ductal, the tumor may also be in situ or invasive. This classification indicates whether in their contained in a specific point on the breast or if it has already started to spread through the organ. Among the types of cancer, there are some characteristics that favor the multiplication of cancer cells, such as metastasis, reprogramming of the metabolism in favor of these cells, and also the evasion of the immune system. These studies have been carried out in order to use the immune system to fight cancer, what we can call immunotherapy.
In recent years, it has been shown that breast cancer consists not only of tumor cells but also of significant alterations in the surrounding stroma or tumor microenvironment. These alterations are now recognized as a critical element for breast cancer development and progression, as well as potential therapy targets. Various components of the breast cancer microenvironment, such as suppressive immune cells, soluble factors, and altered extracellular matrix, act together to impair anti-tumor immunity and promote breast cancer progression and metastasis. Natural killer cells are a major component of the anti-tumor innate immune response and are involved in controlling tumor progression and metastasis in animal models. NK cells are able to distinguish normal cells from cancer cells. NK cells can kill target cells that have lost or expressed low amounts of HLA class I molecules, which is frequently the case for tumor cells, including breast tumor cells. Once activated, NK cells eliminate their target through the release of cytotoxic enzymes, as perforin 1 and granzymes, and soluble factors, as chemokines and inflammatory cytokines, which in turn recruit and activate other affected cells. However, tumor cells also have the ability to impair the recognition by NK cells through the modulation of their receptors. In breast cancer progression, expression of activating NK cell receptors decrease, while expression of inhibitory receptors increase. This correlates with decreased NK cell function, especially cytotoxicity. Besides, several stroma-derived factors, including TGF-beta1, are involved in tumor-induced reduction of normal NK cells function. Thus, breast tumor progression involves NK cell dysfunction, and that breast tumor model their environment to evade NK cell anti-tumor immunity. Macrophages represent a major component of the immune infiltrating breast cancer. They originate in blood monocytes recruited to tumor sites through factors secreted by tumor and stromal cells, such as chemokine CCL2. Pro-inflammatory macrophages can induce tumor cell killing and present tumor antigens to adaptive immune cells. However, data from human tumors indicate that presence of tumor-associated macrophages, TANs expressing immunosuppressive markers, correlates with reduced survival of patients with several types of solid tumors. TANs exposed to immune regulatory cytokines and other factors as immune complex promote tumor growth and angiogenesis, tissue remodeling, and suppressing adaptive immunity. TANs produce many tumor-promoting factors such as vascular endothelial growth factors, TGF-beta, and enzymes that support evasion, angiogenesis, and metastasis. Monocytes variably are referred to as myeloid-derived suppressor cells, which are functionally characterized by their suppression of T-cell proliferation and their ability to promote regulatory T-cells. Dendritic cells, DCs, play an important role in the induction of anti-tumor response due to their ability to cross-present antigens to CD4 and CD8 T-cells, thus activating them to attack tumor cells. This maturation depends on the local microenvironment, wherein various factors influence the formation of either tolerogenic or immunosuppressive disease. It has been described that mature disease into primary tumor are associated with fewer metastases and a better clinical outcome. However, tumor-associated stroma shows infiltration of immature disease with impaired capacity to stimulate anti-tumor immunity. Besides, DC maturation towards regulatory phenotype with production of pro-angiogenic factors as VEGF, IL-10, and prostaglandin E2 contribute to tumor growth and inhibit T-cell proliferation.
Adaptive immune system. The persistence in cell replication in the wrong way gives rise to the acquired immune response, which is also recognized as adaptive immunity. They are cells of killing fast and being fast that are able to recognize antigens through polypeptide regions called epitopes, which bind to the cell surface receptors of lymphocytes. T lymphocytes. They are matured and differentiated in tumor. Maturation occurs by gaining molecular groups on the cell surface called differentiation groups and designated by the acronym CD. Close-up differentiation, which are generally glycoproteins. CD1, CD2, 3, 5, and CD7 are differentiation groups that appear for the early stage of maturation. The identification of CD1, CD5, and CD7 indicates the maturity of lymphocytes. The appearance of CD3, TCR, T cells receptor, CD4 or CD8 in the lymphocyte cell's membrane indicate that T lymphocytes have reached maturation and are able to fight antigens. The T cells is the primary cells responsible for the direct recognition and death of tumor cells. T cells perform immunological surveillance, then proliferate and destroy nearly transformed tumor cells at recognizing AAT. T cells' response to tumors is modulated by other cells in the immune system. Some require humoral antibodies directed against tumor cells to initiate the interaction that causes tumor cells death. In the other hand, suppressor T cells inhibit the immune response against tumor. Effector T lymphocytes. The two main subtypes are the auxiliary T8 and cytotoxins that have an ABTCR receptor and the corrective molecules CD4 or CD8 respectively. CD4 T cells. They are cells responsible for the production of pro-inflammatory cytokines and erupt an anti-tumor immune response. LT8 are functionally subdivided by the pattern of cytokines they produce. During the stimulus provided by NPC, a precursor TEO lymphocyte can become T8-on, T8-2, or T8-17 lymphocytes, depending on the cytokine's environment present. Although morphologically indistinguishable, these cells present different patterns of secreted cytokines and consequently different effector response. CD8 T cells. LTCD8 recognize intracytoplasmic antigens present by NHC class I molecules, which are expressed by practically all nucleated cells. Cells infected by virus and tumor cells are usually recognized by LTCD8. After adherence to target cells present an antigen associated with MHC and an appropriate co-stimulus, LTCD8 proliferate and, in a subsequent encounter, can eliminate by cytotoxic and cell that present these specific antigens, regardless of the presence of co-stimulatory molecules. LTCD8 induces the programmed cell's death pathway, apoptosis, in the target cells by action of perforins and granzymes and can also lead to apoptosis by the expression of the false L receptor, CD95, that interact with the Fas molecule in the target cells. The cells with immunoregulatory function have as their basic characteristics the capacity to produce immunosuppressive cytokines such as IL-4, IL-10, and TGF-B. They operate in a complex network of regulatory mechanisms designed to ensure the modulation of immunological response to various antigens for infectious agents, tumors, allergens, autoantigens, and allergens. Among the LT with regulatory function are naturally occurring regulatory LT. LTR on that produce IL-10 and suppress the development of some LT response in vivo, and LT83 capable of preventing the development of this autoimmune by the production of TGF-B. Thus, distinct compartments of antigen-specific T and B cells can be recruited in the effective response at a local or system stimulus. The molecular events necessary for their development, selection, migration, and activation are still being investigated, and the understanding of this pathway will allow, in the future, the specific manipulation of cellular and humoral effect pathway, facilitating immunity to microorganisms and preventing disease.
Immunotherapy. Immunotherapy consists of stimulate the immune system to enhance the body's ability to cope with illness. Treatment has two purposes: strength to the body, define sick cells, mark them so that the body identifies the actors. There are several types of immunotherapy, and their classification varies based on the medication used and its performance in the body. Taking into account its form of operation, it can be classified as active or passive, and specific and unspecified. Active immunotherapy, designed to act on the immune system itself with stimulate and restore immune function. Substance non-specific immunotherapy, or with tumor cells vaccines specific immunotherapy. Impassive or adaptive immunotherapy, designed to act on the tumor with anti-tumor antibodies or exogenous mononuclear cells, with the aim of providing immune capacity to fight the disease. In the treatment of cancer with immunotherapy agents, the main types of substances used are monoclonal antibodies, transference of adoptive cells, cytokines, vaccines, BCG, and more recently, immunomodulators. Active cells immunotherapy refers to treatment of killing tumor cells by injecting immunologic effector cells modified and amplified by genes. The ACI can be divided into non-specific ACI and specific ACI. The immune system cells in the non-specific ACI are activated by lymphocytes of cytokines in peripheral blood, and have the ability to kill a variety of tumors. Immune effector cells in non-specific ACI include dendritic cells, natural killer cells, cytokine-induced killer cells, tumor-infiltrated lymphocytes. Lymphocytes activate killer cells activated by MAC. The main effector cells are CD8 T cells and CD4 T cells. Biological checkpoint is located on the surface on T cells. Checkpoint protein is inhibited under normal circumstances to prevent damage from autoimmune disorders. But when it's find a tumor, it will present T cells from operation. The tumor weakening the ability of the immune system to recognize and destroy tumor cells. PD-1 receptors are distributed on the surface of antigen-stimulated T cells linked to T cells and tumor cells, and can be combined with PD-L1 and PD-L2 ligands to inhibit T cells activation. The picture shows that the use of ICIs can increase the body immune resistance to cancer. In the immune microenvironment, tumor cells and other immune cells release cytokines such as CSF1, TGF-beta, adenosine, among others. Dendritic T cells or other antigen-present T cells recognize cytokines. The B7 ligand and this cell recognize the CD28 receptor in T cells, activate cytotoxic T cells and promoting the proliferation and migration of T cells to tumors. The PD-1 receptor on T cells can bind to the PD-L1 and PD-L2 ligands on tumor cells, inhibiting the activation on T cells and the effective on tumor death. In vivo, it can increase the immune response of T cells against tumor, inhibit tumor proliferation, and prolong patient survival. Immunotherapy is an innovative treatment that dynamically modulates the immune system to attack cancer cells in various targets and directions. Tumor immunotherapy may include ICIs, cells immunotherapy, exosome immunotherapy, and other new therapies.